We're debating on the margins right now on the left and the right about how to change page 300 of Medicare Part D, unless we're attacking the core incentive that was embedded by Obamacare, which was probably the deadliest law passed in recent history. What Obamacare did is it ingrained the incentive that the medical system makes more money when people get sicker.
Sibling team Casey and Callie Means joined the Tucker Carlson show a few days ago to discuss the disturbing trend of sick care in North America. They discussed everything from the toxic food supply and pharmaceutical industry to the corrupted regulators that let them get away with putting profits over real health and wellness, generating lifelong customers instead of incentivizing cures. Casey is a former Stanford Medical School trained surgeon and co-founder of Levels, a health technology company aiming to reverse the global metabolic health crisis. With a BA in honors and an MD from Stanford, where she also served on the faculty, Casey left a thriving career in conventional medicine to focus on addressing the root causes of America's skyrocketing health issues. Her brother Callie is a Harvard Business School grad with firsthand experience in how corrupt the food and pharma industries are. He co-founded TrueMed, a company dedicated to enabling Americans to purchase healthy food tax-free. The interview ran just over 2 hours, so I'm going to break down some key clips here, and I urge you to watch it in full by following the hyperlinks in the written component of this report. In this shocking expose, Casey gives a baseline overview of the standard American's health, and it is not reassuring.
The word I used earlier, destroyed, is not hyperbolic in any way, shape, or form. 74% of American adults now are overweight or obese. Close to 50% of children are overweight or obese. 120 years ago, when someone was obese, there were case reports written about it. Yes. Literally, there were people in the circus if you had obesity.
Sideshow fat. Yeah, it was so unusual.
It was so unusual. It is now 74% of our country. 77% of young adults are unfit to serve in the military because of these issues like obesity. Now let's talk about diabetes. 50%. A full 50% of American adults have prediabetes or type 2 diabetes, which is a fundamental issue in how our cells... Half the country, Tucker, have prediabetes or type 2 diabetes, and 30% of teens now have prediabetes. This was a condition that no pediatrician would have seen in their lifetime 50 years ago. 1% of Americans in 1950 had type 2 diabetes. We have 18% of teens with fatty liver disease, a disease that used to be in late stage alcoholics. Cancer rates are skyrocketing in the young and the elderly. Young adult cancers are up 79%. And this is the first year in American history we're estimated to have over 2 million cases of cancer. 25% of American women are on an antidepressant medication. 40% of 18-year-olds have a mental health diagnosis. We have the highest infant and maternal mortality rate in the entire developed world, despite spending 2x on infant and maternal care than any other country. So you have a higher risk of dying as a woman giving birth in America than any other developed country in the world. Autism rates in kids are 1 in 36 nationally. This was 1 in 1,500 in the year 2000, and the screening has not changed. Forces that are creating slow, progressive illness starting now in fetal life that allow patients to be profitable and on the pharma treadmill for their entire lives. They make us sick, but they don't kill us, and then we are drugged for life. You look at what's happening in children. A child born in a hospital in the United States today, within hours of coming from source into this body, the first thing that happens to them is pharmaceutical intervention. Without really asking, there's barely informed consent about this. That child's eyes are smeared with erythromycin ointment, and they're given a hepatitis B vaccine in their first day of life. And what are these two things for? I mentioned this because it's just emblematic of how we're put on the pharma treadmill from the moment we are born in this country for reasons that are very strange. The erythromycin ointment is to prevent chlamydial infections of the eye, which we test women for chlamydia. So why would every baby in the United States need this ointment if the mom doesn't have it? And the Hep B vaccine is for hepatitis B, which is a sexually transmitted disease and IV drug user disease, of course, which babies are not going to be exposed to. And yet every single baby in America is getting the intervention. So from literally the day we are born, we're on this treadmill.
Why not test the pregnant mother for those?
They do.
Okay, so
they give it to the women who even if they have tested negative.
Which would be the overwhelming majority.
Absolutely.
Casey and Callie explained that there are several aspects to this, including the fact that medical schools and those employed at them are either funded or captured entirely by the pharmaceutical industry. This rigging of the system is further explained by Casey.
All aspects of modern American society are rigged against the American patient to get us, addicted to food, allegiant to pharma, and just spending 10 hours a day on our phones, addicted. And now we are all sick. Our bodies are breaking, and it's leading to all these organ-specific symptoms that are related to a very simple root cause.
Callie elaborates on how social justice policies have further impacted real health and wellness, with the priority of funding given to drugs instead of focusing on diet and lifestyle changes.
And a key point in America is that we listen to our medical leaders. We changed our diet when the food pyramid came out. Smoking rates plummeted when the Surgeon General report came out.
The majority of Americans got the COVID vaccine.
When Dr. Fauci said, get the vax, most people, we respect and listen, but medical providers, they actually literally have social justice components where they're actually not able to recommend natural food because there's a component in the USDA nutrition guidelines which takes into account social justice. So they're worried about affordability.
May I ask what does that mean? So it's racist to eat non-poisonous food?
In America, it is classist and racist to suggest that mothers shouldn't be poisoning their kids.
How are we so delusional that we think it is easier to inject a child weekly for life than find a way to get that child healthy food? Like that is a track that we're on right now. That is insane, but we're believing it. We're drinking that Kool-Aid. It doesn't make any sense. We could take these dollars so simply, so easily, and funnel them towards healthier diet and lifestyle. $3 trillion a year. We could feed every single American family with organic food for $3 trillion a year. But instead, we're taking those healthcare dollars and steering them towards drugs, which doesn't fix the root cause issue.
Our message isn't drug or anti-drug. It's just like, let's look at the problem. Like say you're just an alien that came down from space. You look at America, kids and adults are just overwhelmingly metabolic dysfunctional, obese, diabetic. It's like you'd never say, like, let's keep happening and then jab everyone and drug everyone and manage the good. It was just never, it's just follow the science. Maybe drugs actually do come into play there, but the history of chronic disease medications has been a complete disaster.
Casey also explores the connection between global conflicts and the ongoing battle for genuine health.
I mean, I think it's really interesting to think about the relationship between war and what's happening.
100%.
So where did all these pesticides that have destroyed our life-giving soil and are creating a fragile food system, which is going to create a food crisis at some point, where did they all come from? Nazi Germany, right? So Hitler was developing chemicals of war and trying to create agriculture solutions to create more food yields for Germany. And some of these pesticides, these organophosphate chemicals, were turned directly into sprays that we're putting on all our food. The interrelationship between Nazi Germany and what's being sprayed on every piece of food in the United States is deeply linked, and we need to think about that.
Right.
15% of...
And one other thing I just want to say, this is being federally subsidized by the government through the farm bills. We haven't spoken about the farm bills, but you think about this funneling of money that's happening and how the government in a way is working against us. And I don't think it's nefarious at all. I think people just don't understand. We've talked to so many Congress people. They just don't understand the health effects of all these things that are happening, of the processed foods. And, everyone likes their Oreos. So it's a tough issue because we're addicted. But the farm bills are making all these unhealthy foods cheaper. They federally subsidize commodity crops, which are turned into processed food. So this is the corn, the soy, the wheat, making these foods artificially cheaper. So this is why, people say, this is where the social justice piece comes into it. It is, in many ways, it is much harder as a poor American to buy food that is not poisoned because our government is making the poisoned food cheaper. What is happening? We don't even...
It's not a free market.
It's not a free market at work. This is not a free market. It's rigged. It's rigged against poor people.
The pair calls for a shift in how all of this is approached moving forward to stop incentivizing the perpetuation of chronic disease and the obesity epidemic.
What our big mission is like, we need actually a new paradigm of how we view chronic disease. I mean, it's actually just a lie, right? That if you have a high cholesterol, high blood sugar, and depression, you're seeing 3 different doctors who aren't talking to each other at all. That's just wrong. It's very profitable, but it's wrong. You're on 3 different lifetime plans. You can really solve it with the root cause. And that's, if the medical system was sane, right, with lower costs and unleash human capital. We're debating on the margins right now on the left and the right about how to change page 300 of Medicare Part D, unless we're attacking the core incentive that was embedded by Obamacare, which was probably the deadliest law passed in recent history. What Obamacare did is it ingrained the incentive that the medical system makes more money when people get sicker. Through this populist idea of like taking on the insurance companies, it said insurance companies can only make a 15% profit margin medical loss ratio. They need to pay out 85% of their spending. But because now insurance companies can only get 15%, but by law enshrined in Obamacare, they can raise premiums to get that 15%. What's their incentive? Your incentive is for the pie to grow. Your incentive is for costs to go up. So Obamacare actually incentivized insurance companies to have no cost controls. What does no cost controls mean? It means more people getting sick. So we're talking about inflation a lot right now. By far, the top driver of inflation in America right now is healthcare. And that's happening because there's no rein on costs. There's no rein on costs because everyone makes money when we get sicker. That's
Even
how it all
insurance
connects.
companies.
That's
so if 85% of their budget has to go to care, they take 15% by law from Obamacare. The more that we spend actually on healthcare, the more expenditures for patients, the more their 15% grows.
When the panel said, listen, give it to 6-month-old babies with zero assurances this possibly would be safe. I said, where were you the day when the WHO came out and said, do not use remdesivir in the hospital? I'm Dr. Peter McCullough. Join me for an evening together. Tickets are on sale now.
Callie elaborates thereafter that an emergency declaration could immediately address and reverse childhood chronic illness and obesity. He then describes how presidential executive orders could stop all of this tomorrow.
An executive order tomorrow could make it that USDA panelists cannot take money from food companies. What an idea. It can sign an executive order tomorrow that NIH grants can't go to conflicted researchers. 80% of them currently go to conflicted researchers. You could sign an executive order tomorrow that the FDA should stop being funded by pharma.
75% of their funding comes from pharma.
75% of the FDA's funding doesn't come from taxpayer, it comes from pharma. And there's a revolving door, as we all know, where people go from the FDA to pharma. Institutions in the DC, as we both know, are built to grow. The FDA grows when the pharma's influence grows. The FDA should be an independent organization. It's not. That's an executive order tomorrow. So you just rob the conflicts of interest out of these things. Personnel. Assign doctors that we both know onto the USDA nutrition panel and have the president, have the secretary of the treasury, because we're going bankrupt from healthcare costs, have the secretary of defense, because 77% of young adults aren't eligible to join the military. Have them say, we are not banning any company. We're not even giving public policy recommendations, but we are saying from a medical perspective that we should reduce ultra-processed food consumption among children.
A major problem in all of this is a compromised media.
Our information sources have been totally co-opted.
Yeah.
50% of TV news spending, coming from pharma is a huge deal. And why the hell is our media playing referee for defending pharmaceutical companies? Why
are they suppressing?
And silencing
Why are they
doctors?
suppressing any questions around that? That's a huge problem that our dominant information sources for the past generation have been able to be co-opted by an industry that, just as a statement of economic fact, profits from Americans getting sick. Just undeniable.
In closing, Casey shares advice on what to avoid and how to choose healthful options.
The number one thing that people need to understand is we need to stop eating ultra-processed food. We need to stop eating.
So what is ultra-processed? Can you just give examples?
Absolutely. So ultra-processed food is basically all the things that you're seeing at the grocery store that have this laundry list of ingredients that usually are based on 3 ingredients: ultra-processed flour, ultra-processed added sugars, and ultra-processed seed oil. So this is going to be like white flour, cane sugar, and things like cottonseed oil, safflower oil, sunflower oil, soybean oil. So these crappy foods that did not exist 150 years ago, ultra-fine white flour, added sugars, and seed oils.
That's like all brand name
It's
foods.
like everything. I mean, we have a list in the book of what you should not eat, and it's basically everything at the grocery store. I mean, we should all be shopping at there are 9,000 farmers markets in the United States right now. People can make the effort and reprioritize their values to focus on getting nutritious food. We need to be eating organic, unprocessed foods for the vast majority of our calories. And we need to get back to having a sense of pride and responsibility in our households to cook food. You know, one of the unintentional downsides of the feminist movement is that we somehow made people feel that food preparation was like a less than activity. I bought into this for my entire early professional life, that it was somehow beneath me. I was like a slave in the kitchen if I was cooking for husband or family. There is no more important thing we can be doing than feeding our children and our families healthy food.
The final point of the interview was on antibiotics and the cumulative effect all of this is having on society as a whole, but especially our children.
It's making
There's
us,
forces that want
it's
them dull.
reducing our IQs. It's making us lose our minds early with Alzheimer's. It's making our kids not able to sit down and learn because of ADHD and autism rates that are skyrocketing. And it's all going up all at once. And we know it's because of our toxic food systems and the chemicals in our environment. And we're not protecting kids. And that is very sinister. And I think, you know, on the biggest macro level, like at the kind of the most zoomed out spiritual level, like I think, you know, what we have to realize is that like we are miracles. Like every human is a miracle. This life is a miracle. Like this is spiritual beings having this insane experience on planet Earth. And fundamentally, the thing that we're doing with metabolic health is we're making energy in the body, right? The way we're doing that is we're taking food that got its energy from the sun, right? Like the sun literally, photosynthesis happens, it creates starches in plants, and then we eat them or animals eat them. And what metabolism is taking the starches that are stored energy from the sun through photosynthesis, liberating it in our bodies to create energy to fuel our minds and to fuel our bodies so that we can think and reach our highest purpose. And right now, in the vast majority of Americans, our toxic food system is blocking that process, which means it's blocking the miraculous process of essentially taking this beautiful, this is not woo-woo, this is just fact of science, taking this universal sun, light energy, and liberating it to fuel our lives. That is broken. This is dark. This is very dark. Americans are not only sick, but the core process of being able to create, you know, and transform energy is broken. And we need to fix this because we need all hands on deck right now in America to solve these big issues. And we need to be thinking properly, feeling good, and we can rapidly with some of these simple changes.
One small way we're trying to affect change at Rebel News is by calling on our federal Minister of Health, Mark Holland, to revoke market authorization of the risky and injury-inducing novel COVID-19 injections at nomoreshots.ca. At that website, you can sign our petition and send Minister Holland a form email urging him to do the same. That's nomoreshots.ca.